Assalamu alaikum. Dear student, I am Dr. Anisa Sadiq, Senior Registrar, Gynae. Today the lecture will be on premenstrual syndrome. The lecture is on premenstrual syndrome, and this is a very beautiful picture which is showing the female suffering from premenstrual syndrome. Now, what will be the learning objective? The learning objective is at the end of the lecture, you people should be able to define the premenstrual syndrome and list the clinical feature of premenstrual syndrome, that what are the clinical feature of premenstrual syndrome, and discuss different management option of the premenstrual syndrome. Now, what is premenstrual syndrome? I mean, what is the definition of premenstrual syndrome? The premenstrual syndrome is the occurrence of cyclical, somatic, psychological, and emotional symptoms that occur in the luteal phase of the menstrual cycle and resolve by the time menstruation ceases. Means the premenstrual syndrome is related to the luteal phase of the menstrual cycle. That it start with the luteal phase of the menstrual cycle and end when the menstruation ceases. In some female, it starts 3 to 4 days before the menses and ceases or dissolve after at the 3 4 days of the menstrual cycle. Now, what is the etiology of premenstrual cycle? What causes premenstrual cycle? Premenstrual syndrome. The precise etiology of the premenstrual syndrome is unknown, but cyclical ovarian activity and effect of estradiol and progesterone on certain neurotransmitter, including serotonin, play a vital role. The most important is serotonin in the premenstrual syndrome. Now, mostly the premenstrual syndrome is idiopathic, but low level of certain vitamins like vitamin B6 and minerals like calcium, magnesium, isoferrin, all these are involved in the premenstrual syndrome. And those people who are taking high sodium intake in their diet, they are also having exposed to premenstrual syndrome. And people taking alcohol and caffeine also suffering from premenstrual syndrome. And depression. The patient depression is that when the patient by herself is suffering from depression, there is family history of depression, then there is increased chances of premenstrual syndrome in these ladies. Now, changes in hormone. The hormones which are involved in the premenstrual syndrome are mostly estrogen, progesterone, and serotonin. Serotonin is basically a chemical and neurotransmitter in the brain, and when its level is decreases, that it is lead to premenstrual syndrome. And stress. When ladies or females are under stress, or they are central factor predisposing to stress, then there are increased chances of premenstrual syndrome in these ladies. Now, the clinical manifestation of premenstrual syndrome, that what type of feature are present in ladies suffering from premenstrual syndrome. This is a diagram in which the female are having different attitude. Look at this ladies, she is much disturbed, her mood is changed, and look at this, She is having increased craving for the food, and also this lady is also having craving for certain foods. This lady is suffering from abdominal pain. So this picture is showing different picture of the premenstrual syndrome. Now we are dividing the clinical picture of the premenstrual syndrome in different heading. Now pain, what type of pain is present in the patients suffering from premenstrual syndrome? They are mostly having headache, breast pain, abdominal cramps, muscle stiffness, backache. Mostly ladies are complaining of low back pain in their premenstrual syndrome and generalized body aches. And these ladies, the breast pain and the headache, these are mostly due to fluid retention. And these mostly occur due to increased sodium intake. Now, water retention and water retention is also due to increased sodium intake and certain other things. And when patient is having water retention, there will be bloating sensation, breast pain, and weight gain during their premenstrual syndrome. The third is the third and the most important is behavioral changes. The female may be suffering from having low performance, difficulty in concentration. She may be irritable. She may be having depression, forgetfulness, low judgment, anxiety, feeling like loneliness, and some are having feeling of pride. In extreme cases, they may have suicidal attempt and autonomic changes. Some female are suffering from dizziness. They may become faint, having nausea, vomiting, and hot flashes. And the exact symptom and the severity vary from woman to woman. Most women with PMS only experience a few of the possible symptoms in relatively predictable pattern. Mean they are knowing that I am suffering from PMS. So every lady is having different variety of sign and symptom. In the future of the ladies are also changed from one woman to another woman. Some ladies are suffering from other symptom and some ladies are suffering from the other symptoms. Not of the same. Now, this is a picture which is showing classifying the different clinical features, a clinical manifestation of premenstrual syndrome. Look at the psychological symptom. Women may be irritable, there may be mood swings, depressed mood, crying spell, low self-esteem, anxiety, sleep disturbances, increased appetite, and cognitive symptom. She may be having forgetfulness, decreased concentration, low performance. In physical symptom, there may be breast tenderness, bloating, fluid retention, weight gain, constipation, hot flashes, headache, and musculoskeletal discomfort, acne, rhinitis, and palpitation. These all are a variety of features from which the women are suffering in the premenstrual syndrome. Now diagnose. How you will diagnose a lady suffering from premenstrual syndrome? There is no unique physical finding or lab test to exist physically diagnose premenstrual syndrome because there are a variety of sign and symptom, variety of symptom clinical feature from which the ladies are suffering. So there is no unique physical finding and lab test to diagnose the premenstrual syndrome. A more severe form of premenstrual syndrome is called premenstrual dysphoric disorder. When the condition is more severe and ladies are suffering from more severe symptoms, then that condition is called premenstrual dysphoric disorder. And the other thing for the diagnosis of premenstrual syndrome is that to keep A daily diary. When the mild symptom, they some improve, but when the patient is not improving with medication, then the ladies, the woman may search for a doctor, and for the diagnosis of the premenstrual syndrome, the doctor advised them to keep a diary or log and record the symptoms you have, how severe they are, and how long they last. You should keep this symptom diary for at least 3 months. It will help your doctor to make an accurate premenstrual syndrome diagnosis. Mean you are keeping a diary with yourself and you are recording your symptom, from which symptom you are suffering in the premenstrual syndrome, when they are started and when they are in. And also you will be recording the day and your menstruation is started and when your menstruation is finishes. You will record all these things in your diary, and this diary will be continuous for the 3 months to make a proper diagnosis of the premenstrual syndrome. And when this is not helpful, then another thing is gonadotropin releasing hormone try test, in which the gonadotropin releasing hormone are given to the patient and are seeing whether her symptoms are improving or not improving. If her symptoms are improving, it means they are suffering from premenstrual syndrome. If they are not responding, it means the patient is suffering from some other diseases. Now, this is the premenstrual syndrome, the same picture in which the ladies is having variety of sign and symptom. This is not much clear, but in this picture is showing increased appetite. This is showing backache. Is showing constipation. This patient is suffering from fatigue. This is suffering from acne. This is having headache. So in this picture, different lady is suffering from a variety of sign and symptom. Now management. How you will manage a patient with premenstrual syndrome. Basically, the management is very complicated, and a variety of methods are available for the management of premenstrual syndrome. When mild symptoms are not improving by herself, then the ladies are searching for a doctor. We will start the management from simple therapy. Simple therapy means lifestyle changes. In the simple therapy and lifestyle changes, you will take simple therapy and lifestyle changes. You will take drinking plenty of fluids, taking balanced diet to maintain overall health. You people will be taking supplements like folic acid, vitamin B6, calcium, magnesium, and isoferrin, and taking rest or sleep at least 8 hours per night to reduce fatigue, and will be doing regular exercise. Maintain regular exercise. Exercise, due to exercise, there is exercise, elevated mood, and reduces fatigue. So, exercise should be continued for at least 30 minutes every day, and also helpful for other things. Now, this is a diagram which is showing different level of treatment of the premenstrual syndrome. In this initial step, look at this lifestyle adjustment that include a good diet, exercise, and good habits. Mean increase intake of fiber diets, avoid alcohol, caffeine, and high, uh, high carbohydrate diet, and also take supplements. This first line is simple pharmacological treatment. Then, when the patient is not responding to the simple treatment, then they will be going towards the pharmaceutical treatment, like medical treatment. Now, diet, less fat, sugar, salt, caffeine, and alcohol, frequent starchy meals, preferably high in fiber, more fiber, fruits, vegetables, and stress management. This is important. If the patient is suffering from stress is a very important factor in which the patient is suffering from premenstrual syndrome. So stress management is very important to reduce the symptom of premenstrual syndrome, like relaxation technique, by watching TV, newspaper, or some music, etc. Yoga, meditation, breathing technique, and counseling. Counseling is very important. In counseling, we are counsel the family, friends, and the patient by herself. They to reduce the severity of the symptom. So this is a simple therapy, pharmacological therapy of the simple therapy for the treatment of premenstrual syndrome. Now, medical treatment means that's pharmaceutical treatment. When the patient is not responding or not improving with the um, simple therapy, then we are prescribing pharmaceutical or medical medication or the counter drug. Mean in the form of NSAIDs like from Sanford, Naproxen, and Morphine. These are for relieving the headache, abdominal pains, lower abdominal pains. Okay, and the other is selective serotonin reuptake inhibitor in antidepressant. When the patient is suffering from depression or they are not responding to the simple therapy, then we are prescribing selective serotonin reuptake inhibitor. The serotonin, this is basically a chemical and it is involved in control of the mood and other psychological symptom. So these drugs like fluoxetine, citalopram, and citalopram are prescribing but in the medical treatment of the premenstrual syndrome. And second is cycles suppression. Mean to suppress the menstrual cycle by giving combined oral contraceptive pill. Combined oral contraceptive pill is the most effective regime appeared to be in improving the symptom of premenstrual syndrome. It is prescribing either in 2 or 3 packs without break. It is most effective. And mostly the combined oral contraceptive pill which we are prescribing, it should be drospirenone base, drospirenone, which is also having anti-mineral corticoid and anti-androgenic activity to improve the other sign and symptom of premenstrual syndrome. And the other is transdermal patch. On the skin, there is estrogen patch are applied, and this causes ovulation suppression or cycle suppression. And when cycle is suppressed, then the premenstrual syndrome are the silent symptom of the PMS will be reduced. And other thing is cyclical or continuous and luteal phase progesterogenic position. Progesterone are given. In cyclical mean for 21 days or for just for 10 days in the luteal phase. And the other thing is resistant PMS. Resistant PMS is where the premenstrual symptoms are not responding to the previous treatment or other medication. Then the last resort is GnRH analog. And when GnRH analog gonadotropin releasing hormone are very effective treatment for PMS is they turn off ovarian activity. To reduce the risk of osteoporosis, it is recommended that the continuous combined form of hormone replacement therapy is administered with GnRH. When we are giving GnRH to patient for premenstrual syndrome, then we are also prescribing HRT, hormone replacement therapy, to prevent osteoporosis. Now, surgical treatment. Surgical treatment in the form of hysterectomy with bilateral oophorectomy only we perform if all other treatment have failed. And the one important thing is that before going for hysterectomy and bilateral oophorectomy, a gonadotropin releasing hormone in lung test trial should be given to the patient to ensure that switching off ovarian activity will resolve or cure the problem of the patient. Mean we are giving GnRH analog to the patient. When they are improving with the GnRH analog, then we are mean that hysterectomy with bilateral septal oophorectomy will be giving cure to the patient. So the surgical treatment, it is a last option for the patient. And other alternative therapy, these are herbal medication. In the form of standard John Moore, using primrose oil, these are losing in routine and the patient are showing improvement with these drugs. These two drugs are basically herbal medication. And other is cognitive behavioral therapy, and this is also very effective when combined with selective serotonin reuptake therapy, cognitive or posting technique. Okay, there are other conditions which are similar. Am I making the premenstrual syndrome? What is one is chronic fatigue disorder, one is thyroid disorder, and last is pregnancy. So different investigation will be done for these disorder, rule out these disorder from premenstrual syndrome. And how we will prevent PMS? It will be prevented by doing regular exercise, taking balanced diet, lifestyle modification, as I already discussed with you people, and get enough rest. Enough rest will solve most of the problem. Thank you.